Hi, I'm Dr. Natalie Weder, a senior child and adolescent psychiatrist in the Psychopharmacology Center at the Child Mind Institute. And this is Good Question, Eating Disorders edition. Eating disorders are a pretty sensitive topic, but people often have questions or misconceptions about them. So today, we're answering some of your questions from the internet about different eating disorders, symptoms, and the recovery process. Let's get started. This question comes from Google. Why are eating disorders more common in adolescence? During adolescence, just from a developmental perspective, we're changing a lot. Not just the way we think, but also our body changes a lot. Teenagers in general tend to be very self-conscious. They're very aware and sensitive to what people think about them. All of that makes them much more vulnerable to an eating disorder, where they might think that they need to look a certain way to fit in and to not feel like an outsider. You also have a lot of stressors at that age. You have a lot of homework, a lot of pressure to go to a certain college, to achieve certain things. If we then add that there's a lot of media and a lot of pressure targeting teenagers to look a certain way, to be a certain way, then all of that increases the risk for eating disorders in adolescence. Our question comes from Google. Why are eating disorders considered mental health disorders? Mental health disorders in general have to do with the brain and the way we think. And an eating disorder is something related to the way we think about ourselves. We tend to think that we're overweight when we're not, or that there's something wrong with our appearance or our body, that it's actually not the case. We sometimes restrict what we eat and we do extreme dieting, and sometimes we overeat and we can't stop ourselves. We don't feel like we have a control over what we eat, either on the restricting, I want to eat something but I can't because otherwise I want to gain too much weight, or I know I need to stop eating this, but I just cannot because I have to compulsively keep eating. This question comes from Reddit. Does disordered eating mean you have an eating disorder? Are these the same thing? They're not. Disordered eating means that you have irregular eating behaviors, that they're not very structured, that they change, that sometimes you might not eat enough or sometimes you might eat more. That can definitely lead to an eating disorder. If you think of an eating disorder, it's like a much more severe degree of irregular eating behaviors. But irregular eating behaviors every now and then don't constitute an eating disorder. Our question comes from Reddit. Does anorexia look different for boys? It can. It doesn't always look for boys. There are definitely boys who worry about their weight and who also restrict and have very similar patterns to girls. Something that we see more in boys than in girls is a focus on body mass, muscle. It's not so much that they don't want to be super thin, it's that they want to be able to have a lot of muscle mass. And so they think that if they eat anything that will cover their muscles, anything with fat and so on, then they won't look the way they want. Something that is really important to know is that many times eating disorders in boys are not recognized. And so they're also undertreated. And that is something that we need to be very aware of. This question comes from Reddit. How do I help my friend who has an eating disorder? My best friend told me a couple of months ago that she has been going days without eating for a good while. I'm the only one she's told. I've talked to her about it and told her that I know it hasn't stopped, but she keeps denying it. I don't know what to do and I feel so bad for just sitting around and not doing anything. What should I do? I think that you're in a really tricky situation and I think it's great that you care so much about your friend. Knowing that she can come to you for help or advice is incredibly important. It can get very tricky because if sometimes you start asking too much and pressuring too much, the person might withdraw and not share so much. But I think the most important thing is to recognize that if somebody has a problem, they need help. So to let an adult know so that this person gets the help they need as soon as possible. This question comes from Reddit. Can eating disorders be related to trauma or autism? I think in general, anybody can have an eating disorder, but there are certain associations. So for example, there's a very specific type of eating disorder called avoidant restrictive food intake disorder that we see more commonly in autism. We don't only see it when people have autism, but you see it more. And in that disorder, people are very sensitive to the texture or the feeling of food and they eat very little, they're very picky, they find it really hard to just eat food and not feel an aversive reaction. And we know that people with trauma have a higher risk for many mental health disorders, including eating disorders, but depression and anxiety. These have all been great questions, and I hope you continue to ask questions and remember to lean on your friends and family for support. But that's all the time we have for today. For more information about eating disorders or to get support, click the links in the description below.